You know what? By now, you should know that the battle against the COVID-19, aka the new coronavirus, is not humanity's first war for survival. From the Black Death, the Spanish flu, the multiple man-made genocides, to the First and the Second World Wars, mankind always had a chance to survive. But as Egyptian novelist and Nobel Prize winner Naguib Mahfouz once said, the lesion of our ally is oblivion. So let's not forget how we were always subjected to heavy media campaigns, spreading fear from invisible enemies and government-made scarecrows, while creating and promoting an illusion of safety and security to the public, only to justify the madness behind the nuclear and biological arms race. It looks like we were left exposed and bareback by those same governments and decision makers who seem to be a bit lacking when it comes to strategic planning. With no solid rescue and containment plan in case of an actual attack, as the news of the virus outbreak started, we could see the lack of emergency medical facilities and supplies, and how the worn-out existing healthcare systems are being wrecked under the attack of what's described as a mild virus. Witnessing millions of people being strained with almost no financial support during the public quarantine, because apparently there aren't enough government emergency aid funds to help the ones affected by those crucial circumstances. Most importantly, let's not forget all the souls that could have been saved if those cuts in healthcare budgets were not approved, or if healthcare sectors were given more importance while planning the official government spending to begin with. Because unfortunately, healthcare sector was one of the most convenient areas to suffer while applying austerity policies. Don't you agree it's about time for those people in charge to stop acting like cliché Hollywood government villains and maybe for once listen to the experts' advices and warnings when given to them, taking in consideration the multiple virus outbreaks the world had already seen in the past 2 decades? But as the world stays in a full lockdown state, diminishing all hopes of a chance to a better treatment abroad, let's hope they learn their lesson while being trapped in those same and out of supplies old medical facilities they've been repeatedly neglecting over the time. And as for my fellow citizens of the world, it's okay. It's really okay to be confused and overwhelmed with everything happening around us. The world is a strange place now. With everyone locked in, it's starting to look like ghost towns, the news pouring from everywhere, and I don't blame you for not knowing whom to believe and trust. After all, we've been fed nothing but lies over the years. But still, it's not our job to figure out who plotted this cosmic conspiracy against us. Also, not spreading false assumptions and rumors will be highly appreciated at the moment, so please, stop posting and sharing those posts, starting with, "My cousin knows a doctor who said." We don't all know doctors. And I really know how suffocating staying at home might feel, but we should all keep in mind that the official numbers of the coronavirus cases might be a bit deceiving, making us think it's nothing to be scared of. But before we let our brains drift that way, we should remember how we're told to stay home in self-isolation, even if we show symptoms, meaning not all infected people are being tested and documented in official records. But it is our job to stay safe, stay home as much as possible, and adhere to the public health regulations recommended by the WHO, meaning, wash your hands, please. Let's take this as an opportunity to spend time together. Not just time, some quality time. with each other. Also, it would be the perfect time to provide financial aid to the ones in need around us, your neighbors, the poor sectors of your area if you know them. And while we're at it, let's put a little thinking into our next choices, who we're electing to speak on our behalf in world summits. Make up our minds on advocating our rights in better healthcare and education systems. Maybe reject more government spending on one army all the time. Let this be our wake-up call, because we need to set our priorities right. Let's remember who's fighting on our behalf, barely shielded with a face mask and a pair of gloves, if available, on those empty hospital storage rooms. The people worthy of our praise, admiration, and appreciation are the ones trying to save our body parts in hospital ICUs, not the ones exposing theirs on social media. Let's fight for their rights and enhance training facilities, work conditions, and safety measures, as they are fighting for our lives right now.